In the news, we'll hear about 2 new FDA approvals, patients' thoughts on shared decision-making, continued positive results for the first oral proteasome inhibitor, and kudos and concerns about the Center for Medicare and Medicaid Services proposed oncology care model. These stories and more start right now on AnkhLife News Network. Hello and welcome. I'm Laura Jones. Exciting news in the setting of thyroid cancer. Last week, the FDA approved Lenvatinib for the treatment of patients with progressive radioactive iodine refractory differentiated thyroid cancer. This approval comes 2 months earlier than the expected decision date. Approval is based on data from the SELECT trial, which randomized 392 patients in a 2-to-1 ratio to either oral Lenvatinib or placebo. Lenvatinib-treated patients had superior progression-free survival and higher objective response rates. Dr. Marcia Brose from University of Pennsylvania discusses how Lenvatinib will be used in practice.
I think that Lenvatinib will be used both in the first and second line setting. It'll be used in the first line setting in a lot of patients who are newly diagnosed as RAI refractory and progressive. It'll also be used in the second line setting because there are already a large number of patients out there who have been on other kinase inhibitors either through clinical trials or because they've been on sorafenib because it was approved. And those patients will all also benefit very much from Lenvatinib. So I think that they'll probably be treated in a lot of both settings going forward. So in sorafenib, you have to really watch out for hand-foot syndrome, counsel your patients how to manage it. The important thing there is to let them know that most of the time the severity goes away after about 3 to 4 months. It starts improving. So sometimes that can help patients sort of manage it and not get too discouraged when they actually encounter it. With Lenvatinib, the side effects are less hand-foot syndrome. That's not such a big deal. It's really the blood pressure that's going to be the #1 thing. It's going to be very important to counsel them with the diet because weight loss is significant on this drug. And in addition, also diarrhea, which can contribute to the weight loss as well. And then for more rare side effects, you do have to warn them about up to 10% of the patients did have evidence of clots, and you have to be aware of that.
And just this week, the FDA approved the expanded use of lenalidomide to first line for patients with newly diagnosed multiple myeloma. The approval was based on results from phase 3 studies, including the first trial, which evaluated continuous lenalidomide in combination with dexamethasone until disease progression versus the standard MPT regimen. Celgene reported significant survival benefits with continuous lenalidomide. The results demonstrated that patients in the continuous lenalidomide arm had a 25% reduction in the risk of death compared to patients in the MPT arm. A new study demonstrated just how important shared decision-making is to patients receiving cancer care. The Cancer Care Outcomes Research and Surveillance Consortium study, also known as CANCORS, surveyed over 5,000 participants diagnosed with lung and/or colorectal cancer about decision-making preferences and perceptions of quality care. Of over 10,000 decisions assessed, 39% of those decisions were categorized as patient-controlled, 44% as shared, and 17% as physician-controlled. Quality of care and communication with physicians was rated higher in patients who reported more shared decision-making. 58% of those surveyed expressed a preference for greater involvement in the shared decision-making process. Even in those patients who preferred their doctors control care decisions, still reported less satisfaction with the quality of care if decisions were in fact physician-controlled. According to the article in JAMA Oncology, given the increasing emphasis on patient experiences and ratings in healthcare, these results highlight the benefits of promoting shared decision-making among all patients with cancer, even those who express preferences for less active roles. More positive results for Takeda's oral proteasome inhibitor ixazomib. In a pre-specified interim analysis of the phase 3 Tourmaline MM1 trial in patients with relapsed refractory multiple myeloma, the overall response rate was 92% with the ixazomib combination regimen. Overall, 55% of patients reached a very good partial response or better, including 23% who experienced complete remission. Dr. Sajay Kumar from the Mayo Clinic explains the importance of this agent.
A very convenient, very effective, and very tolerable regimen. Particularly side effects like neuropathy that we noticed with bortezomib is not very evident in this group of patients being treated with ixazomib.
Ixazomib is also being tested in frontline and maintenance settings.
The Centers for Medicare and Medicaid Services is accepting applications from oncology practices and payers to participate in its Oncology Care Model initiative. The goal of the Oncology Care Model is to utilize appropriately aligned financial incentives to improve care coordination, appropriateness of care, and access to care for beneficiaries undergoing chemotherapy. This initiative aims to support community-based oncology practices and physicians in developing improved service delivery and reimbursement strategies. The model intends to improve health outcomes, produce higher quality care, and lower costs. The American Society of Clinical Oncology believes that the Oncology Care Model is a positive step forward, but is still concerned that relying on what it calls a broken fee-for-service system will limit innovation in payment reform models. For more information, visit the Innovation Center at cms.gov.
Finally, this week, we would like to feature the AnkhLife Peer Exchange, the 2015 update on colorectal cancer. Moderated by Dr. John Marshall, a panel of expert researchers and clinicians discuss screening practices for colorectal cancer, genetic testing, and treatment optimization for patients with metastatic disease. To glean the keen insights from our panel, please visit the website on our screen. That'll do it for this week. Thanks so much for joining us on AnkhLife News Network. I'm Laura Jones. We'll see you next time.